Hi everybody, so today we're going to be talking about the veins of the heart. And I already have a video talking about the arteries of the heart, and today we're going to talk about the veins and basically how we drain the heart and get blood back into circulation. So you're looking at two different views of the heart here. This is going to be the anterior view, this is the posterior view. So if we look, this would be my right side, and then this would be my right atrium. So I'm just going to write the word atrium in here because we're going to look at this in just a minute. And then this is going to be my left side, this would be my left atrium, this is my left ventricle, this is my right ventricle. So the first thing we're going to talk about are what we call the anterior cardiac veins, and you're going to have between about 2 and 7 of these. So these are going to be the anterior cardiac veins. Okay, and that's going to be these that are right here. Now these are going to basically just drain right into this right atrium, and they're going to drain the anterior portion. They're going to drain the anterior right atrium. And again, it's the myocardium that they're draining, right? The muscle of the heart. The right atrium and the right ventricle. Okay, now, on the side here, we're going to have some other veins. And this is going to be called my right marginal vein. That's right here. So this is going to be the right marginal vein. And that's this right here. And that's going to be draining the right ventricle. Now, the right marginal vein, a lot of times will just basically drain right into this right atrium, or sometimes it's going to join another vein, which we're going to get to in a little bit, and it will then drain into the right atrium. Either way, it's going to end up in the right atrium. So there's my right marginal vein, which is going to drain my right ventricle. Over here now, if you look, this is called the interventricular septum right here, and this is the anterior portion of the interventricular septum. In front of the interventricular septum, you're going to have something called the interventricular groove, and in that groove, we're going to have a vein. Now, this could, depending on the sources you use, it can go by two different names. So it can go by the great cardiac vein, or a portion of the great cardiac vein, which they call the anterior interventricular vein. Okay, and it's going to start here at the apex. Let me go like this. This is actually the vein coming up right here. It's going to start at the apex of the heart. Now, here's what's going to happen is the anterior interventricular vein and the great cardiac vein are going to drain two portions of the heart. When I say drain, I just mean it's bringing blood from there eventually back up into the right atrium. So here's what's going to happen. This is going to drain basically the superficial myocardium. Remember, the myocardium is the muscle of the heart. This is going to drain the superficial myocardium of both ventricles. And when it gets to the top of that interventricular groove, remember the interventricular groove is going to be on the front part of this interventricular septum, and it's going to curve, and when it does, this becomes the great cardiac vein. Okay, so this is going to be the great cardiac vein, right? And then what's going to happen is the great cardiac vein is going to have some tributaries from this left atrium. So this is also going to drain the superficial myocardium from the left atrium. Now what's going to happen is this great cardiac vein is going to continue on, and it's going to go posterior. Okay, so it's going to continue. This is called the coronary sulcus. It's also known as the atrioventricular groove. But this great cardiac vein is going to be in the coronary sulcus, and then what it's going to do is it's going to go on the posterior side of the heart, and it's still going to be in the coronary sulcus on the posterior side. So what we're going to do now is we're going to start looking at the posterior side of this, okay? But really quick, so I have my interventricular septum. On top of the interventricular septum, you have the interventricular groove, and in the interventricular groove, you're going to have the anterior interventricular vein, which some books will just call this whole thing the great cardiac vein, okay? But anyways, this is going to come around the back here. And now we're going to go to the posterior side, right? So where that line is, that's the posterior side. So now this is going to be the left, and this is going to be the right. So now this is my right atrium again that you're going to see over here. Here comes my great cardiac vein. All right, this is the curved part around it. So this is, once again, the great cardiac vein right here. And then it's going to continue in this posterior coronary sulcus. And just to reiterate one more time, some books will call that the the atrioventricular groove. But either way, this is going to be my great cardiac vein here. Now, we had a right marginal vein over here. Over on this side, we're going to have a left marginal vein. And my left marginal vein is going to drain into this great cardiac vein. So this is going to be my left marginal vein right here. And it's going to drain into this great cardiac vein. When I say drain, it just brings the blood up to there, okay? So that's going to happen there. So now, and this is going to basically take blood from the left ventricle. The reason they call it a marginal vein is because it's on the margin of the heart. Some books will actually call these different names, but we're just going to go with the left marginal vein. So now, here's what's going to happen, is we are going to have another vein that's going to be basically draining or taking blood from this left atrium, and it's going to come like this. And now, this can happen anywhere along in here, right? Because everybody's kind of different. And we're going to call this the oblique vein of the left atrium. Okay, the oblique vein of left atrium, or you can call it the oblique vein of the left atrium, right? And this is going to be it right here. Now, after the great cardiac vein and the oblique vein of left atrium meet, this is going to become something called the coronary sinus. And it's going to come over here into the right atrium. So I'm going to write this over here, my coronary sinus. And you can see this enlarges, right? This is my coronary sinus here. All of this is my coronary sinus. Okay? So that's the coronary sinus. Now, here's what's going to happen. Is also over here in this left ventricle, I'm going to have another vein that we're going to call the posterior vein of left ventricle, or you can say of the left ventricle. And I'm just going to make this right here. Okay, and obviously this is also going to drain my left ventricle. It's going to come into this coronary sinus right there. Okay, some books will actually call this the inferior vein of the left ventricle, okay? So we have that, right? The posterior vein of the left ventricle, the left marginal vein that's on the left ventricle, and they're all coming into here. Now we have our coronary sinus. Now, we said a minute ago this was called the anterior interventricular septum, and on top of that we had the interventricular groove. Over here, we're going to have the posterior interventricular septum. So here's my posterior interventricular septum, and then on top of that, we're going to have something called the interventricular groove, the posterior interventricular groove. In the posterior interventricular groove, I am going to have something, a vein that's going to start down in here, and it's going to continue up. And again, I'm drawing these on the side, right? I'm drawing this and this on the side, but remember, they're going to be on basically in that groove that's on top of this. And this vein is going to drain into the coronary sinus. This vein we're going to call the middle cardiac vein. So there's my middle cardiac vein. This is going to drain the posterior wall of both ventricles. Right? And it's also going to drain the posterior interventricular septum, so the muscle that's there, right? So the posterior interventricular septum. All right, and then that's going to come up, and it's also going to go into that coronary sinus. Now, the coronary sinus continues along here, and then what it's going to do is it's basically eventually going to drain into this right atrium. But just before it does, I'm going to have another small vein And in fact, that's the name of it, the small cardiac vein. Okay, there's my small cardiac vein, and it's going to meet the coronary sinus just before it drains into this right atrium. This is basically going to take blood from the right atrium and the right ventricle, and it's going to drain it into there. So let me just go like this real quick so we can separate these out. Okay, so my middle cardiac is going to do the posterior wall of both ventricles and the posterior interventricular septum. My small cardiac is going to take blood from the right atrium and also from the right ventricle. And by the way, when we were over here talking about this right marginal vein, this can also, if it doesn't go straight in, if it doesn't go into the right atrium, it can also just join the small cardiac vein. But either way, then what's going to happen is this is going to have an orifice, right, an opening, and the blood's going to drain into here. So this is going to drain into the right atrium just medial to the inferior vena cava. IVC stands for inferior vena cava. So here comes my blood, and now it's going to drain into that right atrium there. So this is called the greater system of the veins of the heart, right? So the greater system is going to be made up of basically my great cardiac, my middle cardiac, my small cardiac, and my anterior cardiac veins. Okay, that's going to be the greater system or the great system. You're also going to have what we call the small system or the smaller system, and that's going to be a little bit different. I'm going to use this as an example here, and what we're going to do is I'm going to pretend like I'm just putting I'm just blowing this section up and I'm making it larger. So what's going to happen is you're going to have your endocardium. Right, so this is going to be my endocardium here, and then behind the endocardium, you're going to have myocardium. Now remember, this goes the whole way, but I'm just making it just this one portion enlarged, okay? And now that's going to be my myocardium. Now, coming off of here, I'm going to have these little veins that are going to drain directly into the fourth chamber of the heart, and these are going to call Thebesian veins. Okay, so these are Thebesian veins. Now, here's what's going to happen is in these veins, what's going to happen is basically the blood is just going to drain directly into the chambers. Okay, and now where you're going to have the most of them is going to be in the right atrium. The least are going to be in the left ventricle. Okay, but again, they just drain directly into the four chambers of the heart. So that's it. Oh, and this is the smaller system, right? So the greater system is the great cardiac, the middle cardiac, and the small cardiac, and the anterior cardiac veins. The smaller system or small system of veins of the heart is going to just be the Thebesian veins. Okay? Anyways, that's it. Thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button, and we will catch you next time. I'm going to leave this up here for just a few seconds so you can see it.